Hi, welcome to TRTA TV. My name is Hope Osborne. I'm the Team Support Coordinator for TRTA, and today I have with me Tim Lee, the Executive Director of TRTA. How are you, Tim?
I'm good, Hope. How are you?
Good.
Good.
Well, we have you here today mostly to talk about some national news coming out of Washington. As you know, there is a discussion that there might be some increases in Medicare Part B premiums.
That's right.
What's the latest on that?
Well, right now we are on a path to seeing Medicare B premiums increase about 52%. As a matter of fact, it is exactly 52%. In the history of Medicare, we've seen this happen a couple of times where a group of current Social Security recipients are excluded from an increase in Medicare premiums, and another group of retirees who are receiving Social Security benefits because they were public workers, so it's not a full benefit, but a partial benefit, they would have had a premium increase. It's never been this bad. As a matter of fact, there's never been a premium increase in Medicare's history that's as high as the one that we're talking about today. And essentially what this comes down to, Hope, is that 30% of the people in Medicare are going to pay 100% of the total cost of this increase. And anytime you have a small group of people paying the entire cost of an increase, the burden is disproportionately high for those individuals. And that just happens to be our TRS retirees.
So what can our retirees do about it?
Well, the first thing they have to understand is, why is this happening? And many of our retirees don't understand if they're going to be impacted or not. So because I was in another district earlier today, and a lot of questions were asked, I think it's important to kind of point out who is affected. First of all, if you are new to Medicare in 2016, so whether you have full Social Security benefit or you have TRS and Social Security, if you're going to turn 65 in 2016 and you're not yet on Medicare, this cost increase is going to affect you. Then another group of people, and most of our folks, when we think about how many people may be affected in Texas in TRS, we are thinking about 120,000 or more individuals in TRS-Care who also have Medicare are going to be affected. So it's a big portion of our members, and many people are confused. They think this is not going to happen to them. But if our folks are receiving a partial payment from Social Security, maybe they have their 40 quarters, maybe they have 50 or 60 quarters, this is going to affect them. Very few people in Texas are going to be exempt from paying this who are under our TRS-Care program. People who may have 30 to 35 years of TRS and Social Security history, those folks may not be impacted. But again, of all the people that we think could be affected by this, a very small percentage, less than 10,000 people in TRS probably will not be affected by this if they're already on Medicare. So if you're watching this video and you have TRS-Care as your primary insurance and you have Medicare either through your own work history or your spouse's work history, it is very likely that you're going to be affected by this issue. And so we have a limited window of time that we can actually get anything done right now. Congress is on a short break. I think they come back next week. We need phone calls, and lots of phone calls. We put out an inside line last week. We're going to send out another one today where we're going to talk about people being able to click here to send an email, which is our members love to do that. Congress is a little bit different. Those emails do not get to their congressional member nearly as fast in Washington, D.C. As they might here in the state legislature. And because the window of time is so short, we need many phone calls, whether you're affected by this or not. And again, more than likely you are. We need you to call your congressman and ask them to support whatever effort is being made to fully fund Medicare for this year so that it is not put on the backs of our retirees. There are a couple of bills that are being introduced that will deal with this issue. We have H.R. 3696, which is a measure that's been introduced in the U.S. House, and then there's a Senate companion bill, and they're just the same bill, just one's in the Senate, one's in the House, and that's Senate Bill 2148, or S2148. So these two measures have been introduced. There is no way that these bills are going to pass. There's not enough time. And so what we need is the spirit of the bill to carry forward in the actions of the Congress. And because it's in bill language, the Congress can take the language out of these bills, put it into the procedural actions that they can take, and fund it accordingly, and hopefully avoid our retirees having the increase that we're talking about having.
Great. And while we're talking about Congress, I guess we should also get an update maybe on what's going on with the WEP.
Congressman Kevin Brady is still organizing support. We are making a big difference in making this issue more known in the United States Congress. And so far, it's been good, but we're also losing time on this one. It would be great if we could get this initiative to move forward now so that the Social Security Administration can adequately plan to give our retirees an increase. If this measure were to pass, our retirees will get anywhere between a 30 to 37% increase in their Social Security benefits if they are affected by the windfall elimination provision. For all future retirees, the windfall elimination provision is actually thrown out, and a new formula is being applied that will pay people for the amount of contribution they actually make to Social Security. So this is it's the Social Security Fairness Act. It's something that Congressman Brady has been working on. It's HR 711, and we are really seeing a lot of support in Texas. And where our members can be a little more influential is maybe to contact some friends and families in other states and ask their congressman to support this bill as well.
Great. And more locally speaking, I know that TRS has a town hall meeting coming up. Do you have any more information about that?
That's a great question. The TRS Town Hall Meeting is kind of our first opportunity to start discussing solutions to healthcare for TRS-Care. Mm-hmm. So we've talked a little bit about Medicare, and we've talked some about the windfall, but this is, as you said, real close to home. It's our TRS-Care program. TRS-Care has been funded for this biennium, but we also have an interim study committee that will start soon. The interim study committee will sort of pick up after this first town hall meeting. I think the teacher retirement system is working hard to provide information through their board of trustees and their staff so that stakeholders like TRTA and its members can have a better understanding of what is happening with the health insurance program and why is it costing so much. I know it's a big question I get asked all the time. How can we go every biennium and see that we needed $768 million this time, and next time we need another billion, and the time after that we're going to need another $1.5 billion. The problem is health insurance is not costing anyone any less. And I think what TRS is wanting to introduce are some of the efficiencies in the systems that we might be able to apply, or other medical trends that they're identifying that will be useful to us as we partner with the House and the Senate in their interim study. So if you are local in the Austin area, or what we call District 13, which are some of the surrounding areas with the Austin, Texas area, by all means, come here and sit at the TRS building. I believe that's October 22nd. That meeting is going to start pretty early. TRTA is hoping to provide coffee and some refreshments so that you can come and sit and listen. But it is a full day. It's going to be an entire day, 8 till 4. So you might want to come for part of it. You might want to come for another half. But it'll be an exciting day, and we've got a lot of work to do.
Great. Well, thank you so much for your time today, Tim.
Sure.
Don't forget to like us on Facebook and follow us on Twitter. Again, I'm Hope Osborne. Thanks for watching.